On the mass.gov online source, which pulls all information from hospitals about vaccines and the virus COVID-19, Martha's Vineyard's cumulative percentage of people vaccinated over the age of 12 is 119%. And that means there are more people written down as being vaccinated here than there are people who we know live here. And that's, along with other things, it's you can call it disturbing, you can call it like questionable. It sparked a lot of interest because Martha's Vineyard, we all know, I think, well, everyone lives here, we all know it's a very unique place, but there's a number of things that started happening sort of under the surface with this virus that I don't think we really accounted for going into this. And looking back on it, it was super interesting to kind of look into that and figure it out. So I decided with my project that I wanted to see the extent to which Martha's Vineyard has been unique during this virus. And in the process of doing so, the Omicron variant happened.
Britain, Germany, and Italy announced their first Omicron cases. They follow Belgium.
More than 21,000 new cases for the second day in a row.
That's ridiculous. We need billions of tests. We need them now, especially with a widely spreading variant that everyone could have
Fully
predicted.
vaccinated means boosted as well.
Schools in Maryland and Missouri shifting to virtual learning days before winter break.
The Omicron variant of COVID-19 was declared a variant of concern by the World Health Organization on the 26th of November. Since then, it has impacted communities around the world and become widespread over the holidays. In Massachusetts, the three coastal counties, Barnstable, Dukes, and Nantucket, showed alarming infection rates during the Omicron outbreak. On an island isolated geographically from the rest of the state, Dukes County, or Martha's Vineyard, showed a unique trend in infection rates and spikes. At its peak, over 11% of the population got infected with COVID-19 during December of 2021. I am a senior at Martha's Vineyard Regional High School, and like many, this outbreak has caused me concern. While most students had been excited to take steps towards ending mask protocols this winter, some are expressing concerns of going back to online learning if the outbreak continues to worsen, especially if a breakout were to impact school staff.
That data actually that showed on that graph there is also outdated. We have since reached an all-time spike on January 7th of 26% of the island being infected as far as we know. And that's like an alarmingly high percentage of people having actually gotten the disease. The amount of people that it was at once, all those numbers are really, really difficult to find out. And that was one of the first things I started looking into was, why do we not know these numbers? Why do we have a vaccination percentage over 100? Why does everything seem so weird here? And so there's a number of things I started looking into, and I started with before the pandemic, and I looked into things like what our vaccination rates looked like before we started getting into this. And it turns out Martha's Vineyard has a running sort of theme of not being the most vaccinated county, and actually regarding kindergarten students going into schools as of 2020, we had the lowest percentages for both exemptions from vaccines and exemptions and also no vaccines at all across the entire state. In both places, we have like, I think almost 8 times the average of the entire state. And I did just want to kind of put this up because it shows, you can see against all the other counties, us in Nantucket, but Martha's Vineyard the most, is alarmingly unvaccinated. And this is before the actual pandemic happened. A lot of those numbers did become interesting later on, and I did just kind of want to go over that because going into what happened and why we have such weird percentages, it was interesting to look back on that first.
I know prior to the pandemic, Dukes County had some of the highest unvaccinated rates, and that was clustered in up-island districts like West Tisbury, Chilmark, Aquina. I could be wrong, which worries me because my son goes to West Tisbury School. The New York Times put out that Trump counties have higher death rates due to COVID because of lower vaccination rates. So that is fascinating just in general. So yeah, I would say our island is not much different, although we tend to be more on the liberal side. So I would say, and some of those people are very educated and still choose not to get vaccinated. So maybe our...
So I did also want to show this slide again that was up there for a second. This New York Times article spoke about how comparing counties that were 60% voting for Trump in the 2020 election, or 60% voting for Biden, or somewhere between 60 and 40% for either, the death rates of people getting infected and the infection rates make this sort of trend where those that voted for Biden are on the bottom and those that voted for Trump are on the top, and they follow a very similar sort of curve as time goes on. And this sort of sparked there being a connection between this and politics. On the island, we have our own very interesting set of politics. We're actually very unique. We have a very sort of rural environment, and we have a very liberal sort of democratic political system. And that's very, very unique to being here. We do sort of follow the trend of the rest of Massachusetts, but that's kind of just, I think we do sort of stand out, and it's really interesting to look at that. So back on the topic of why we have such strange rates of vaccines, I went online to try to find what else we have on this information, and I found there's huge contrast between what websites say. New York Times up there puts us as one of the most vaccinated counties, whereas the CDC literally says our total vaccinated percentage is 3.9%, which is, I think we all know, is obviously not true. I looked into why this is, and there's a number of potential reasons. Some of those are connected to how much of our population we know we have versus what is documented. We have a lot of people here who may not be documented. We may have a lot of people who live here only in the summer. A lot of other things might skew into this, but there's a lot of ways for us to have less people than actually live here counted and tallied as living here, and then more people than that getting vaccinated. One of the major ones was summer populations versus our year-round population. The known number of year-round residents, which is actually, I've determined is probably higher than this number, is about 17,000 people. I made this little circle on the left to kind of represent that population. That big yellow circle on the right is how big we are over the summer. And 200,000 people that can be accumulated over a couple of days or a month. You can see that many people be on the island, which from what I've heard, in a couple of days, you can have numbers maybe half who are approaching that on, good weather. I think we'll hit that. If only 1% of those people were to get vaccinated and have it count as being on the Vineyard, that's 200,000 people, 2,000 people being vaccinated. And that is a pretty significant proportion of our population. I sort of made that kind of pie chart so you can see the 1% of that 200,000, kind of just a sliver, but compared to us, it's this noticeable amount of people. And this, along with other things, looking at what our hospital has estimated our vaccination rate to be at, is probably an underestimation. When you look at how people get vaccinated over the summer, if you have to get vaccinated somewhere else, you get your county of residency written in, and you have to say where you live, you have to show evidence. And a lot of summer residents here have houses here. I think everyone here knows that. So if they're only here in summer, they get vaccinated, they put that in, and then they leave the rest of the year, that's a ton of vaccinations that we get that then don't actually count because they don't live here. So we just get to boost the vaccine tallies, and our population doesn't change. So this, along with other things, was my best, I guess, discovery of the explanation behind we have such strange numbers. But then I sort of wanted to look more into what do we do now, since we sort of have this running problem.
I'm just coming off, this is a touchy subject. My husband, who's 41, fully vaccinated, got a breakthrough infection. He didn't need to go to the hospital or anything, but he was sick enough that he was down and out for a good 4 to 5 days. I definitely think the more people we can try to minimize the spread, because it disrupts everybody's lives. My kids were out of school for 10 days. I was running back and forth. My husband was separated in a separate house from us for that long. And what's been frustrating about this is we seem to have some solutions, and because we're taking so long for enough buy-in, that it just keeps getting worse, and it's just prolonging the process of getting over this. And that's sad to me, that we can't figure out as a society to buy into solutions.
We've been patient, but our patience is wearing thin, and your refusal has cost all of us.
Look, aside from grotesquely and wrongly otherizing, blaming, and vilifying millions of Americans, look at how little vaccines have actually done to stop the spread of Omicron. By now, most Americans know a double or even triple vaxxed person who has tested positive recently.
So moving on in my projects, something I started to do was really dive deep into the political divisions that this is causing. That last slide, I did kind of put Ms. Glockels in 2 times, but it really spoke to where a lot of this is coming from, and that's rooted deep distrust caused partially by our political system, partially by people, in just the way we're addressing this. Different political parties, I think most people would associate sort of like that Republican view with being like the conspiracy theorist of vaccines don't work, and the government, like everyone's heard the microchip theory. I mean, that's not true, but it's something that I got to do. I do have to keep some anonymity to this, but I got to interview someone who had opposing views. They did not have strongly Republican or right-wing views, but I spoke with them about why they didn't want to be vaccinated and sort of like what that sort of connected to. And they told me a lot of things that I actually realized were reasonable approaches to that point of view, and then how it sort of cascaded into where we are now. One of the major ones is our approach to dealing with this from sort of a virological standpoint and epidemiological. I probably pronounced that wrong. We didn't exactly address this virus the way we could have, knowing that it's a respiratory infection and it's not some major black plague sort of mass, I guess, death. We have a lot of known drugs and other treatments that can actually help deal with symptoms. This one I put up here because this was actually interesting. Hydroxychloroquine is not an actual treatment for coronavirus. You shouldn't use it, and I'm outright saying that it's just a objective fact. It does not help. But some major that happened was, I think we all remember during the 2020 election campaign, Donald Trump got infected with coronavirus, which was, I probably lost in the election. I mean, he was given a number of antivirals, and hydroxychloroquine was one of them. And because he had access to such good healthcare and doctors, it actually helped him get over the sickness a lot faster than most Americans would have. And hydroxychloroquine was cited as potentially being helpful in that. Later, it was proven not to be helpful, but what happened was a lot of people started taking to online media like YouTube, Facebook, Twitter, and talking about, like, is this actually going to be a helpful treatment? And these websites are, this roots into a number of other things, but they're run by a lot of very left-leaning sort of figures, and what's the term for it? Kind of like I'm blanking on the term. It's just the people who run it they have a lot of those viewpoints, but they had sort of a bad approach to dealing with people talking about this, which was to just objectively censor it. And it started making this conspiracy theory appear that they're trying to cover this up because it works. And the truth is it doesn't, but this, along with a lot of other things, started leading to clear signs that we're not closing this political gap where we're trying to get the facts across, but people are just miscommunicating. I put this sort of loop up here that shows this is, in the American public, just this sort of consistency in what people's political views are over kind of the last 20 years. And it's actually, is that really 8 years old now? It's been a long time. This sort of shows we're spreading even that long ago politically. The division's getting stronger and stronger. I mean, we could talk forever about how just the political division between both parties is getting bigger and bigger. But a major problem with this is it causes a mistrust and a miscommunication between both parties. And this is evident on the island. A lot of people have talked about how this sort of political division is even affecting us. The Vineyard's known to have this sort of crazy cool community where everyone talks to each other, but we're still seeing this sort of division taking place where people not trusting this are getting battered or like personally attacked for their views. And that might even have been fed into here since everyone knows each other so well.
I think there are people out there that just will say no when you tell them to do something. It doesn't even matter. Get out of the burning house. No. Like, what are you doing? Like, come on. And again, what is it going to take? Is it going to take losing a loved one? Is it going to take, not being able to go to concerts for 50 years? Like, what is it going to take to get people on board? It's sort of a sad state of affairs. The United States is a developed, educated society. So let's not even really get into the inequality of treatments and vaccines throughout the world. The numbers, when they finally come out, will be pretty, I think, staggering.
So that sort of spoke to, I think, looking at sort of that larger picture, which is this disconnect that we kind of see everywhere else in a lot of other communities and counties and states is it's clear. I mean, you can go online, you can see everyone screaming at each other, but it's also when you go around, you see a difference in how people act around each other if someone says that they're unvaccinated. And looking back on the Vineyard, I didn't mention this before, but our community is very unique. And something that I really started to look into kind of more optimistically was how we can work towards getting through this and bridging that political gap, even though it is such a strong division. Martha's Vineyard's community has gotten through a lot of difficulties. I think we all sort of know about, like, there's a lot of housing issues here, there's food problems, and our connectivity and the way that we've found to help each other and all know each other is sort of something that trumps over all those other difficulties. And although I didn't notice at the time, it very clearly seems to be pushing through, especially now. We have sort of passed that peak of the infections and the Omicron variant sort of going crazy throughout our, spreading rapidly throughout the island. And the numbers are starting to come down. Something good that I've seen here is a lot of people still, like, we stayed in school when a lot of other counties didn't. We kept doing sports, we kept running every other little thing that we could get going, and even though it was just complete chaos for the last couple months, we kept everything together, and we just kept going through it. And that's, I think, something that, even if this virus continues to sprawl forwards, is going to be something that holds us together and hopefully gets us through anything else that's going to be thrown at us.
Yeah, I am in my 22nd year teaching at this school. I've never taught at another school. And before that, I came out of the waitressing business. I just happened to be waiting on the head of the history department at the time. I was working at Linda Jean's. And so when I came into this interview, somebody said, "Hey, lucky you, you wait on the head of the history department." And I had no idea. And that was 22 years ago. And here I am. So thank you, Marge Harris.
Well, that sort of goes through the end of where my project sort of went. I'm hoping to get that documentary onto the school website soon. It's kind of like I've got to run it through everyone and get it cleared, but I'm going to get done with that. But looking back on everything I did, this project taught me an incredible amount about the difficulties in making a documentary. Between editing and filming and interviews, and especially just doing the research, I found out it is a lot more complicated of a process than I had thought. And having been someone who was experienced with editing and filming before, I even went in over my head. And I think there was a lot of fantastic takeaways from doing this. One of those was that when you really get to interview people, it's a completely different side of the story when you know them. And that's something I think made doing this project at the school so good, was I knew all the teachers, I knew all the people I was talking to, I knew what a lot of their opinions would be before I even went into it, but it was still so interesting to get to know them. And then that contrast with doing it with teachers I knew less and new people, and even like the school nurse was new this year, and I interviewed him, and it was definitely different, but it was a it's not just like a cool experience, but it was something that I'm glad I did looking back. Even if this documentary were to have not gone well, I feel like that alone was something good. And then the last part was just, I do want to speak to the insane amount of time I spent editing. It probably totaled like at least 20 hours. It just was editing and putting together a documentary. It really taught me how much of a process it is. So like whenever you see at the end of a movie, when there's just like the list of people that looks like more people than you've ever met in your life, like I understand now why there's so many people involved with doing projects like this, because doing this in one semester felt like a rush. It was I mean, I loved doing it. I'm glad I did, but looking back on it, just the amount of work that it takes to completely disassemble hours and hours of footage and try to fit it into, I found it was even more difficult. A short period of time is a challenge, and it's fun to do, but it's not easy to do. And I had to learn a lot as I went. I had to really, there was a couple of times where I scrapped huge pieces of work and started over, but I feel like it was definitely worth it. And soon I'm going to have that up for people to watch. And yeah, that's about my project.